And we're live. Good morning, everyone. Welcome along to September's Webinar Wednesday. I'm Pauline Lunn from In Control Scotland, and
I am Keith Etherington from In Control Scotland. So, yeah, welcome to our Webinar Wednesday this month.
yeah, so today we've got a speaker coming along, Barbara Morton from the Scottish Government, to talk about the National Care Service consultation event, which is going on in the moment, which is, you might have heard, you will have heard of the National Health Service, the NHS. So this is the proposal for the National Care Service. So a really, really important big change potentially happening that will affect an awful lot of people across Scotland. So people who use support services, people who care for them, support providers, local authorities, and everybody in between. So we're really excited to have Barbara come along.
Mm-hmm. Just to say, Pauline, and as usual, the plan is that we have a live stream. We're live on Facebook, we're live on In Control Scotland YouTube, and we're also live on Citizen Network TV, so you can watch in any of those places. And altogether, we plan to be here for about 45 minutes. So if you're really needing a cup of tea, then you don't have long to wait. But of course, you can do that whilst you listen to us as well this morning.
Mm-hmm. Mm-hmm. So before we bring Barbara in and start talking about the National Care Service consultation, we could maybe give you a wee update about what we've been up to over the last wee while. So eagle-eyed or regular viewers will know that we moved to monthly webinar Wednesdays. So we're the first Wednesday of every month will be our monthly webinar Wednesday. And we've got a few of these planned up till the end of the year. And we're still carrying on with so many of you joined in the Thoughtful Thursdays and the Feel Good Fridays as well. And they're happening every other week. So a Thoughtful Thursday one week and a Feel Good Friday the next week. And they're just giving people that kind of safe online space to come together and chat and share the experiences. And there'll be a list of the dates in our new news brief, which is coming out soon, isn't it, Keith?
Mm-hmm. Very soon. Should be out very soon.
Mm-hmm. We're just
a few details to be details to be added, isn't there? Yep. So we've got a few comments coming in there as well. So we just got a warm welcome to all our viewers this morning, and then a note of Barbara Morton, who's the team leader in the Scottish Government Engagement and Workforce Division, and that's our discussion this morning, what the new National Care Service will mean. And then a few people saying hello to us as well, Pauline.
Hello, Gillian. Hi.
Gillian and Michael.
And Michael, hello.
And then Gillian, who's already making her relevant comments, saying it's upsetting that the services currently differ depending on your postcode. So I think that's, when we get into that discussion, I think that'd certainly be one of the things that we might want to think about. Okay, and somebody from SDS Options and Fife joining us as well. Oh, sorry, right, okay, we're just getting all our highs coming in, so that's all right. Sandy. So we know we've got people from around Scotland anyway joining us, so that's great.
Mm-hmm.
Yeah,
good to see you all. So what have we been up to the last few weeks? So we had our last webinar Wednesday, but was it 2 weeks ago? I think it was, just in the middle, towards the end of August.
2 weeks. It was very good on that, Pauline. It was very interesting, I thought. Because we were talking to you about starting with In Control Scotland and what you felt and what you'd been doing before.
You were, yeah. Absolutely. And I'm still here, which has been great. But we, what have we been up to the last few weeks? A few things for you to have a wee look at on our Facebook page. Dr. Danielle Farrell's just uploaded her latest Being Danielle video. And in that, if you've been following those, Danielle kind of takes us through daily experiences of what it's like for her going about her business and our life and our social life. But in this one, which just got uploaded, I think yesterday, she talks about coming to our first face-to-face meeting in over a year. And she came to meet with a group of us to do some planning for one of In Control Scotland's programmes called Working Together for Change. So
I haven't watched that one yet, Pauline. Have you seen it yet?
I have. Okay, you are in it.
Yeah, I thought so. Well, yeah. And it's in a big space that we managed to get, isn't it? So that we could keep socially distanced, because we were keen. We originally tried to have that meeting a few weeks previously, didn't we? And then really just on reflection, decided that there would be too many people for what would have been a large meeting room previously. So now we've got an enormous big space, haven't we, that we use there, which is an office space that's been vacated, basically. So
no, it was good. Just these things that we need to take into account, isn't it, as we move into this new world? So making sure we've got enough space and enough air between us, that we're not all breathing on each other. So so the Working Together for Change meeting was about developing a new programme for that. So we are going to be inviting applications for that really, really soon. Again, there'll be details about that in the news brief. Keith, do you want to say a wee bit about it?
Sorry, I was just going to say that with the plan that the programme itself will start at the end of October. So we are racing towards those times, aren't we? So we're going to very soon get out that information to allow people to both think about it and then get their applications in if they're interested in being part of that Working Together for Change programme. That's one of the things that we were doing last year that got completely interrupted by the whole COVID pandemic. So
And we've got quite a busy weekend this weekend as well, don't we? We've got Partners in Policy Making restarting on Friday. So that group of folk started. When did they start? 2019?
So they started in autumn 2019, the Partners in Policy Making last cohort, which was the 5th group of people that we've done, started. And then again, their programme, which relies very much on people getting together and sharing and learning together, was interrupted in March 2020, of course. So they are getting back together. And this first one is a wee bit of a sort of refreshing, just checking out with each other, making sure everybody's okay session. So but that's really exciting, and it's amazing that we're actually getting back together to be able to do that.
Getting the band back together
with it in a sensible and socially distanced way as well. I mean, we are actually not going to, are we, Pauline? We did a message. We recorded a message, which is going to be a wee film that'll be at that program. So obviously, just thinking about trying to keep the number of people, still thinking about the ways that we keep the number of people who get together down as much as possible.
And bringing in all the brilliant guests that we would normally have, sometimes just on a big screen instead of coming in and being part of the hotel. And then what have you got on Friday night as well, Keith?
Well, Friday night we're back doing the Staplet Scotland live sessions. So it's the first. Again, we took a short summer break, and with Michael McEwen, with friend and colleague Michael McEwen, we are bringing not the Saturday Night Live, but the Staplet Scotland Friday Night Live music sessions back on Friday evening. So we will have a few new things, a few old things. We're going to try and do more. We mix it up a little bit from the program that we finished with in June. So, but again, it's going to be a monthly thing on the first Friday of the month, and normal broadcast time, 9 p.m. normal places.
Excellent.
Here on Facebook and YouTube in Control Scotland, Staplet Scotland, Facebook, Citizen Network TV, Gig Buddies Coronavirus Festival page. So it's goes out to all sorts of different places. So there's no excuse for not watching it.
Bring your glow sticks and have a wee rave and online.
Yeah.
Sounds good.
That's Friday night this week.
Excellent. And then
the National Committee's meeting in a couple of weeks' time to plan future things. So
brilliant. Excellent. And then one other thing that we did was myself and Alistair as well went along to the launch of a new app developed by SCLD called Human Rights Town, which is really cool. It's free to download on the Google Play Store or on Apple App Store, I think it's called. And it's an interactive game for people to play, to walk through a virtual town and find out how people's human rights might be at risk or not being respected. So it's a really, really cool wee app. And Alistair had a bunch of folk together in Inverurie to kind of work together to feedback to SCLD their thoughts on it. So it's very cool. Check it out if you're interested. A really good wee educational piece. I've already shared it with loads of folk. I have completed it as well because I'm a bit of a dork. But it's really cool.
That's good. Yeah, there's Vivian saying that she'd like to do the Partners in Policy Making program, so that's something she's been interested in doing. We've got someone from SDS Options and Five asking Citizen Network TV how that's going. Yeah, it's going well. There's Citizen Network TV broadcasts stuff from all around the world, so it also broadcasts lots of the No Labels, No Walls festival last week that was on, which is a international festival, so there's lots of that stuff on there if you're interested. But if you want to see it, just go to Citizen Network TV YouTube and just Google it, and that'll get you there. And sorry, got too many messages here. Working Together Change Program, that's it. Sharing details on Facebook, on the website. Stay up late from 9 to 10:30. See, when we do a monthly, when we only do a monthly one, there's lots of things we're putting out there on the messages. Yep, and Human Rights Town on our Facebook page, and Alistair saying that there was a really good discussion on the app on possibilities for extending it not only to Human Rights Town, maybe to Human Rights City. It looks like there, I think.
Human Rights Universe.
Okay, should we bring Barbara in?
Yeah, absolutely.
Today's guest, yeah.
So press the magic button and she arrives. Welcome along, Barbara.
How are you?
Oh, I'm fine. Sorry. Yes. Hello, everybody. Really pleased to be here. Nice to meet you all.
Good.
Yeah, likewise. Thank you so much for coming along today. So we're going to spend a wee bit of time together just finding out more about this idea of a national care service and what the consultation's all about. So I don't know if it would be helpful, Barbara, if you could just introduce yourself and tell us what your job is, what you do, and we can go from there.
Sure. And thank you very much for having me. I'm really, as I said, really pleased to be here. So hello, everyone. My name is Barbara Morton. I'm the National Care Service Policy Team Leader in the Scottish Government's Mental Wellbeing and Social Care Directorate. And for those of you who haven't met a civil servant before, I've been a civil servant for the last 27 years, and our role is to deliver what the government of the day wants to see happen. And we've also got a role to advise them about the best way to make those things happen as well. But I think that's quite enough about me, because I want to get on and talk about the National Care Service consultation. So I'm going to try and sort of cover a bit about why we're consulting now about our National Care Service, what the idea is, the difference we hope it's going to make, and I'll come on and talk a little bit about how you can get involved and what the process is as well. I should say, if you see me looking away at any time, I'm going off in the background to look at notes and things like that. I've got all my notes written on a piece of paper, but I want to make sure that I give you the right information. So if I look away or something, that's what I'm doing. I'm making sure that I'm saying the right things. So what's the idea about our National Care Service and why are we consulting now? So probably everybody listening will know that there was an independent review of adult social care early in this year, which was set up to look at the state of social care, particularly in light of everybody's experiences during the pandemic. And the independent review found that there was a lot that was good about the way that social care was working at the moment, and especially about people's intentions for social care, but the implementation was really, really key. So this government has... Sorry, Keith.
No, I was just going to say, I suppose that does reflect a little bit that just on that very first comment that we got in, doesn't it, from Vivian there, really, just about the implementation and maybe the variability of implementation and partly why the whole review was carried out in the first place. Yeah.
That's right. So this government is committed to delivering all the recommendations of that independent review. And when the new government was elected earlier in the year, it made a commitment to create a national care service to do that, backed up by an increased investment in social care over the lifetime of the current parliament. So for the next 4 to 5 years, we've committed to increase the amount of money going into social care by 25%, which will mean an extra 800 million over that 4 to 5 years, which sounds like a big number, but obviously it's spread over a lot of people and some time as well. So the other thing that we're committed to is to introduce new legislation to make this happen within the first year of this current parliament. And we've also committed to establishing a social covenant steering group to make sure that what we're doing is informed by people's lived experience. And I'll talk a bit more about that a bit later on. So The idea is that we want to create a national care service, which will mean that Scottish ministers will be accountable for setting a national direction for how we want social care to be delivered. And actually, it's about community health and social care. So what we're proposing is that all aspects of community health and social care services all come under the National Care Service. But we're also proposing that there should be strong local accountability through local delivery boards, which will be called Community Health and Social Care Boards, and they'll be based on the current integration joint boards. So the consultation paper at the moment sets out our proposals for how we think this could happen. And what we're really aiming for, and I guess you can all tell us at the end or at various points if this has been achieved or not, is that everyone who needs it can expect the same standards of care wherever they live in Scotland. Because as you say, Keith, one of the really key things from the independent review, and it's already been mentioned by Gillian, is just the variability that you get. And we want that care to be human rights based approach, and we want the way it's delivered to be informed by people's lived experience, and we want that care to enable people to participate fully in all aspects of life, whether that's in society, in life, in the economy, and we want people to be empowered to thrive because of the care that they're receiving. So I'm going to talk a little bit more about how we think this can happen and about the scope and the reach of the National Care Service. So the independent review just looked at adult social care and create an all ages community health and social care service. We recognise that there's some really important issues here about, well, how does that relate to the NHS? What does it mean for staff and people working in social care? How is that governed and managed, especially clinical governance, and how will standards and quality work? But we think that's the right thing to do. We think the social work profession needs to be part of the National Care Service. We think fair work is really important, and that there are good terms and conditions for social care workers. There needs to be specific reference to paid carers and unpaid carers, to unpaid carers, that was a mistake there. And addiction services need to be part of the National Care Service, and there needs to be inclusion or alignment of criminal justice social work. But we also know that social care doesn't exist in isolation from other kinds of public services, from housing, transport, education, the environment. And so we're really, really mindful of the need to make sure that the National Care Service links up across other public services, and that those collaborations are strengthened by creating the National Care Service. So
it's very broad. It's very, very broad ranging, isn't it, Barbara? I mean, it is. It's an enormously broad. So it's my view. Obviously, it's an enormously broad ranging and wide ranging set of proposals. And it's a very ambitious set of proposals as well. And both those things, we would say, from In Control Scotland's perspective, are really good. Because that's what I think. That's what we would say. That all that's really good, because that's what's needed in order to do what the independent review talks about. That sort of transformational change that reduces the variation, that makes sure that people get the support that works best for them, and that gives people the flexibility, the choice and control, which is what we'd all hope for. Yeah, there's quite a few comments. I don't know whether, do you want me to just put a few of the comments that are coming in? Is that okay, Barbara? Or do you want
of course it is. Absolutely, yeah.
Yeah, so let me just see. I don't know whether we've got some things just saying that there is an easy read version of the consultation, and that you can find it on the Scottish Government page. There's Gillian saying that's good for young children who need full-time care. The fact that children are included. Yeah, and then another comment about just not getting support during the summer holidays. So there's reference to the independent review, which is the review that. So there's lots and lots of things. So lots and lots of comments that have come in there, and also obviously the link to the original consultation. Not the easy read consultation document, but the full consultation document, which is there. So quite a few different things there. And as we say, I've said, a very broad ranging and aspirational, ambitious, all those sorts of things. I think it's fantastic that Fair Work is in there, because that's a really important aspect. I think it's great that the whole thing about planning is in there. It's interesting, the change of terminology. What did you say they're being called now? They're being called community health. Is that right? No, community.
Yeah, so what we're proposing is to create community health and social care boards, which we'll develop them out of the integration joint boards. But that's not a definite thing yet. We're just consulting. And I guess, like you say, these proposals are very wide ranging. And that's why we've got this consultation, really, because we're actually proposing to go further than the independent review. And that's why it's really important that before we start these changes, it's really important that we get the views of everybody.
And people have got 2 months, haven't they, Bob? First of all, just the really simple thing, they've got the consultation process is from now, really. It's started already, hasn't it?
So it's going to run until the 2nd of November. So it started on the 9th of August and it's going to run until the 2nd of November, which I think is 12 weeks. But I also wanted to say that although we're consulting now, we will be continuing the conversation with people after this consultation period ends, because I'll come on to it in a bit later on in the presentation. But this we can't create a national care service overnight. It's going to take time, and the Scottish Government and all my colleagues in the Mental Wellbeing and Social Care Directorate are going to want to come back out to people and continue the discussions even after this consultation ends. And there will also be a parliamentary process when the legislation goes through Parliament, and the Parliament will want to ask people their views as well. So this isn't a once and only chance to tell us what you think. There'll be lots of opportunities. I guess the other thing, to address some of the comments in the chat just now, and I will come on to it, we're really keenly aware that we can't wait for a national care service for people's experiences of care to be improved. I don't want to take up too much time, but we are also going to implement those parts of the independent review that don't need legislation. We're going to continue the work on Fair Work through the Fair Work and Social Care Group, and this is possibly something for another colleague of mine can come and talk about at another webinar. We're developing a proactive and preventative care programme, which is looking at the ways to improve care now within the current system. Because, as I was going to explain, what the National Care Service's consultation is basically saying is, to get those outcomes that we want to see for people, we think we need to change the system. But the proactive and preventive care programme is about changing things within the system as it is now. So we think it's really important to shift the way that people shift thinking on social care, maybe not so much for people like yourselves or people listening, but perhaps in the more general population. So we want social care to be seen as an investment in people. It's an enabler. It supports independent living. It's about collaboration and working together. It's about relationships and not transactions. And really, really importantly, it's consistent and fair wherever you live in Scotland. So as I said, as you were saying, its implementation is really, really key. And that's why I'm really pleased to see things like the People in Policy Making programme starting up again, because that's all about how you implement the vision of self-directed support, if you like. We think there's 3 things about implementation. So we think there needs to be more science-based improvement in the way that social care is delivered. We think it's really important to nurture and strengthen the workforce, and we want better support for unpaid carers as well. And we want to amplify the voice of lived experience in the new delivery system. So the idea is that the National Care Service, as I said, will define, we call it the strategic national direction. So it's basically kind of set out at national level what we want care to look like and be like for everybody, and also quality standards as well for that. But there will be local delivery boards. As I said, the proposal is they'll be called Community Health and Social Care Boards. We might end up with a different name. They'll be based on the integration joint boards, and they'll work with the NHS, with local authorities and the third and independent sector to plan, commission and deliver services within the umbrella of the National Care Service. And we're proposing that people with lived experience should sit on those boards alongside other professionals to sort of determine the direction that those plans should take.
So can I ask really quickly? Sorry, I was going to say, at the moment, obviously, we've got integrated joint boards, and there's people, there's two kind of different tiers within that, isn't there? There's people who can vote and there's people who can't vote. So would that change with the new setup? Would everybody have voting rights and be able to help make decisions?
Yes, we're planning for that to change, and for people to have, everyone to have voting rights. But that's one of the things that we're consulting on. So we really want people's views on that, because obviously we that's a really critical thing. But we want to make sure that that's right and that works for everyone, because it's complicated. There's upsides and downsides.
Yeah, that's something a couple of comments have come in on about. There's somebody from SDS Options and 5 there saying about the user-led panels are very important, and Alistair saying if we make sure opportunity to take part in the boards is really inclusive and accessible, that would make a huge difference. It's really just, it's sort of reflecting your comment there, Pauline, I think in a slightly different way as well, isn't it? But yeah. Sorry.
Sorry, I was just going to say it's important to have people on the boards, but it can't be tokenistic. We need to make sure they're able to make informed decisions and good decisions if and when that happens. That's really, really important.
Yeah, I couldn't agree more. I should have said, actually, we are proposing that local elected members will sit on the boards as well. But there's more details about that in the consultation paper.
Yeah, I mean, I know when you've mentioned all those things there, Barbara, and like everything that you mentioned, everything that you mentioned, you think, oh wow, that's really important, and then you think, yeah, that's definitely really important. I mean, all those things are really, really important together, aren't they? And actually, if you took any one of them away, so I mean, you mentioned that stuff about early intervention and investment in people, and the fact that we see social care as an investment rather than the way that it may have been seen previously, that all those things are just really, really important. And without each aspect of them, then we're not going to be able to get what we think would be that great future that we're all trying to work towards, or the better future, definitely.
Yeah, I think you're absolutely right, Keith. So the consultation, although it's split into 7 separate sections, and we have set it up so people can go in and just answer the questions of the ones they're most interested in. But actually, when like you say, I'm really glad that comes across, actually, because all the different parts do interrelate with one another. So as you said, so we've got a section on improving how care is planned and delivered in practice, including rights to breaks from caring and what to do about non-residential care charges. And I'll just go into that in a bit more detail if there's time. So in terms of accessing care, as I've said, we want to focus on the support that people need to live a full life and prioritise early intervention and prevention. And we want so that's quite, that's important, but as we know, difficult to achieve. We think there needs to be a single approach to planning support, so that when people move between areas, everybody's talking the same language. We're proposing or calling it Getting It Right for Everyone kind of practice model. That's more for professionals, but at the moment you can sort of see care as a kind of a pyramid with acute care at the top and kind of services for everyone at the bottom. And social care at the moment is operating in that acute space, and we want to make sure that care is available sort of down the pyramid, if you like. There's actually a picture in the consultation paper that explain this a lot better. And as I said, there's other colleagues of mine that are more involved in this, and maybe you'd like them to come along to one of these sessions in the future. So in the consultation, we're asking questions about how people would like to access care and support, what the planning should look like, how people want what kind of help and support people want for that planning, what to get those really good conversations, and how all of that needs to be coordinated amongst the professionals. We're also talking about unpaid carers and rights to breaks, and whether unpaid carers, there should be a sort of universal offer for all unpaid carers, or whether there needs to be personalisation, choice and support, and the kind of the sort of how you make the good balance between those things. The workforce bit is really important, as you say. That's that's the last chapter, but by no means the least chapter in the consultation paper about valuing and supporting people who work in social care. So we've got proposals there around fair work, terms and conditions, training and development. Also, really importantly, personal assistance. So proposals around how we better support personal assistance, and a suggestion that we might have a register, for example, of personal assistance so that they can be supported, and 'cause we know how important personal assistants are in enabling people to make the most of self-directed support. But as you say, all of these things do interlink. So there are some chapters on ethical commissioning and also regulation and scrutiny, which are quite technical, but those things are actually really, really important for achieving the outcomes we want to achieve.
But I'm just going to emphasize the other thing that you said, that people can come to the consultation with their own areas of interest as well. So there are, I think you're describing 7 sections.
Yeah.
And for some people, that'll be the most important section. For other people, it might be the unpaid carers bit that they want to make comments on. For other people, it might be the workforce bit. So you don't need to come and comment on everything, do you? You can come and comment on any of the bits that you think are really important to you, and that you think you've got something to say about.
Yes, that's absolutely right. And we will take all of the comments on board. It won't be the case that if somebody only sort of partially completes it, that won't make any difference. We're going to be looking at it section by section as well. The Scottish Government always publishes reports of our analysis of consultations. So we will be publishing that towards the end of the year once we've looked at everything. We're also running...
Can I ask a very practical question?
Of course you can,
like a very practical question.
Yeah.
And it's just, I mean, is it better for people... So just for an organisation like In Control Scotland, is it better for us to try and gather together a number of views and put them in from that group, or is it better for everybody just individually to send them in? How do you think that would? What views have you got about? Any thoughts on that?
It's entirely up to you and what works for In Control and what works for your members and what works for people. I mean, sort of we're more than happy for people to do both. Some other people have contacted us asking the same question, and we're more than happy for organisations like yourself to sort of put one combined response in. But we're also just really happy to hear from anyone who wants to drop into the consultation on our consultation hub and answer some questions. And all of those responses will be taken into account and analysed. And as I say, we'll publish a full report of what we heard and from the consultation. We are running a series of online events as well. In fact, there's one coming up on improving care on the 2nd of September. The details for that is on our consultation hub on Citizen Space. So it'd be great if In Control could promote those. I'll just try and get up some details actually while I'm speaking.
I went along to the first one just while you're doing
brilliant.
that. I went on to the first one, and I was really pleased to see how diverse a bunch of folk that were there. It was great. So we had really good representation from the people-led policy panel. We had folk from providers, we had PAs, we had folk using services. We had a whole different group of people, and it was dead accessible as well. They had BSL interpreters. They had stuff happening in the chat, so that if you're prepared to keep in touch that way, and it was definitely worthwhile going along to. So we will definitely share those events and make sure people can participate and go along and find out more.
I'm really pleased to hear that, Pauline, and I'll let the team know that set the events up. They'll be really pleased to get that feedback. So so there's one on improving care on the 2nd of September. We'll be looking at community health and social care boards in a bit more depth on the 10th of September. We're looking at kind of what's included, that list that I talked about in children's services a bit later on.
Yeah.
So we've split it up into themes.
So a bit about what's in and what's out almost there.
Yeah,
really.
What's in, what's out. Commissioning and how that can work, and how, really, really importantly, how commissioning can tie back to those outcomes, the really good things that everybody wants to see from social care. Regulation, again, that's pretty technical, but also really important, because how people are regulated, or what people like the Care Inspectorate say is important, is really critical. Fair work and how we can value the workforce. and then we've got kind of a roundup one about all aspects of the consultation. But me and others of my colleagues are also attending events like this to talk about it, and we just really encourage everybody to get involved and to have events and to be talking about the consultation paper and feeding us in your views, because we really are open to all views at the moment. We've got some firm proposals in the consultation paper, but we really want to know what people think about them. I suppose one final thing, I was talking to some people yesterday, and the consultation paper is quite lengthy and it's quite technical in places. We really wanted to not just say that we were going to deliver the independent review, but actually talk about how we think that could happen. And that's why it's a bit involved and a bit technical. But I hope that we've also tried to make it as easy as possible to navigate, and we're really happy to answer questions about it.
And there is an easy read version, isn't there? Which just when did that just recently out, isn't it, Barbara?
Yes, so that was published on Sunday actually, so it was ready for Monday, and there's BSL versions as well. We're really sorry that version wasn't available on the 9th of August when we launched the consultation, and originally the consultation was going to close a couple of weeks earlier, but we extended it by 2 weeks because the easy read wasn't available. I know that people have asked us to extend it by more, but if we did that, it could mean that we wouldn't be able to introduce the legislation for next summer. And that's a really important commitment that the Scottish Government's made to everybody, and we wanted to make sure that that happens.
And obviously by the time sorry.
No, I was just saying, I'm just showing that on screen. So I'll just scroll through a couple of pages whilst we're talking just on screen so that people can see the style of the easy read version. Yeah,
that'd be helpful. I was just going to say as well, obviously when something goes to legislation point, there'll be more consultation, there'll be more engagement with folk. So it's almost like this is page one, and we're pulling together the outline and some of the detail, but a lot more of the detail. There'll be much more consultation to come over the next months and years, I would imagine. Would that be right?
Yes, but I also don't want people also might say, well, we've been telling you for years what needs to be fixed about the system. And actually, before the pandemic, some people will know that the Scottish Government had a reform programme which was looking at a lot of these issues. So I don't want to that's why it's really important for me to be clear that we're not waiting for the National Care Service to come along to start trying to work with other people to improve the way things are now. And that's what that proactive and preventive care programme is really about. Because it's not, and we're also doing a lot of work with COSLA now, just to improve the way the current system works, so that when the National Care Service structures get up and running, things are already better in line with what the independent review said we needed to do.
So is there any way that people can get involved in that proactive and preventative care work stream, or anything coming up that we can get involved in?
I will definitely take that away as a question to go and find out. I'm sure there is, but I don't personally know about it. But I'll pass it on to my colleagues and say that you're interested in.
Just because you're absolutely right. There's people that have got things they need to look at today, and they can't afford to wait until this.
Yeah, no. We really are really keenly aware of that. The independent reviews told us that, and lots of other. Yeah, we've listened to that.
I'm just displaying on screen, Barbara, the style of question there that's being asked as part of the consultation, really. So it's just really the fact that there's a number of open questions, and the open questions relate to each of the sections of the report. So that there's quite a good opportunity there for people to be able to write down, to answer some closed questions, but then also write down their own views if they feel that they're not fully covered by any of the closed aspects. So there's lots and lots of opportunity in there to make your views, to share your views anyway. Yeah.
Yes, that's right. And those are the easy read questions, but there's also the full consultation paper as well, which has got a bit more detail on some of the questions. So as I said, in terms of access to care, we've asked all kinds of questions about how people would like to access care, kind of what routes in there are, what support people want to help them develop those care care packages, how should planning work, and quite a lot about the getting it right for everyone approach as well.
Yeah, can I just share a couple of comments, more comments that have been coming in? So SDS Options is saying that it can publicise on the community. Agreeing with the early intervention is critical. Gillian is saying care sports needs to improve massively. And Emma has sent us. Sorry, Emma sent us a. Well, I'm apologising because it's covering your face, Barbara, not for the comments. So sorry, because it's a big comment. And Emma's just saying, in Scotland we have some great legislation, but about how it's been translated on the ground and carers feeling undervalued. So that's again a reflection that I'm sure you will have heard in other places. Okay, yep, and yeah.
Yeah, thank you for all of those comments. I suppose that's what I was trying to say is we know that we can't wait to improve the way things are now, and we do really want all carers to feel valued. There are probably you already know we've already got carers legislation which gives carers certain rights, and we want to strengthen those through the new legislation. And we have carers centres which are set up specifically to support carers. But as someone who in our family we've sort of realised that one of our family members is going to be needing care, it is a really difficult process, and you kind of feel like you're the only one who's got that person's interests at heart.
There was something really interesting that came through in that first meeting that I went along to about somebody who's a full-time student but also a carer, an unpaid carer, and how difficult it can be when people have got more than one label attached to them, I suppose. So like what am I according to the funding I can receive or the support I can receive? Am I a carer or am I a full-time student? And it would just be great to see that kind of intersectionality and cross purpose kind of brought in as part of this as well, that actually unpaid carers aren't necessarily doing nothing else. They've got a lot else going on in their lives. So really interesting.
Yeah, I mean, what that makes me think about, Pauline, is that often people talk about disability that isn't visible. I've forgotten people would say, but also, I mean, if you're a carer, it's not immediately visible as you walk down the street, is it? So people have all sorts of different aspects in their lives, don't they? And it's important that we see, we see the whole person, and we take that into account when we're thinking about how they can get the best support for them, getting it right for everyone, as you've said, Barbara. I just wondered, is there anything you want to say, Pauline, about, because we're already at 11:43, you see, so time goes very quickly, especially when we're talking about such a big subject. But so it's just an introduction today. But I don't know whether you wanted to say, Pauline, anything about our plans for further opportunities for discussion around the National Care Service proposals and what they'll mean.
Absolutely. So we think this is incredibly important, and actually it really affects everybody in Scotland in one way or another, whether you're working in social care, whether you've got a loved one who's receiving support, whether you're receiving support yourself. It really does touch on everybody's lives. So we're really keen to make sure that the people that are around about us have their say within this as well. So what we've done at this is one of these things. We said we're moving to monthly webinar Wednesdays, and we're already going back in our word. But what we're suggesting is that we use one of the Wednesday spots later in September for holding just a conversation. It'll be led by In Control Scotland, so it'll just be in-house, for us to come together with people maybe who use been on our programs or who follow us on social media or who just engage with us, to come together and give us some of your thoughts so that we can provide a really representative consultation response. So what we're proposing is that we do that on the 22nd of September at the moment, at that kind of 11 o'clock time slot. And it'll just be a Zoom or something rather than a StreamYard. So I mean, we can actually have everybody in the room together. But what we'll do is we'll send out some more details about that when we've got a definite time and a date. But that's what we're looking at the moment. And then what we might do as well is, if people are up for it and they'd rather do something in the real world, in actual spaces, in actual buildings, when you can see the lights of each other's eyes, we might pull together, if there's enough demand, a chat in Glasgow or up in Aberdeen where we've got Alistair as well. So, or anywhere where we've got enough of a bunch of folk who are keen to do it. So we'll definitely be in touch with a bit more detail, and we'll promote that on our Facebook, on our newsletter, all those kind of things. The same usual channels. So watch this space if you'd like to get involved.
Yeah, so it's just about creating opportunities, isn't it? And we've got the for this phase of the consultation, we've got the 2 months to get to the 2nd of November, and creating opportunities really for people to understand it and to understand what they might the different aspects of the consultation and the proposals, and then to be able to hear those voices. Yeah. So yeah, I mean, I think the other thing I was thinking when you were talking there, Pauline, was this is about us. And I think I would always want to say that this is about us. It's not about anybody else. This is about us. This consultation about the National Care Service is about us and about our future, and the future that involves people being able to get the right support and support that works for them. So I think we probably should just about finish for today just now. Just wanted to ask Barbara, have you got any final comments that you'd like to make?
No, I just wanted to say thank you again for having me along here. I've really enjoyed it. I've enjoyed talking to you both, and also just to say, please get involved in the consultation. And I'm really pleased to hear that In Control is going to have another event, and to encourage everyone to sort of tell us your views, because that's what we want. We need to build the National Care Service together.
And a big thank you to everyone who put comments in on the chat as well. It's been great to see people engaged with the conversation. So please come along. If you've been commenting, make sure you come along to one of our chats or get in touch and make sure we can get your views represented.
So I would just say that thanks for coming, Barbara, and nice to have Barbara and Pauline here today, because it was also your first webinar Wednesday in a different role, because last time you were being interviewed, weren't you, really, Pauline, on here? We are, if anybody, we obviously have people who watch it live, but we'll also have some people who will be watching this back later on today or later on in the week or whenever, because it stays up on the different places that it's broadcast to. If anybody wants to make any comments, then please just get in touch with us at the info address. If anybody wants to make any comments either about future opportunities or about what they've heard today, please just use the info address to get in touch with us.
Also, you can subscribe. You can subscribe to the newsletter doing that as well, or you can just pop your email address onto the website as well if you go to. Yeah, and
then our mystery poster here has said a big thank you to all of you who joined us today. Fantastic guest Barbara for providing information on the consultation, and of course to our hosts Keith and Pauline. So that's June, who's in the background there making some of the comments there. Brilliant. And obviously, if you've missed anything in terms of where to get information or any of the links for any of the things, the easy read, the consultation, the full consultation, any of the aspects of the other opportunities to get involved, then also just please get in touch with us. So thank you.
Thank you everyone for coming along.
Yeah, and the next webinar Wednesday is on the 6th. Next formal webinar Wednesday is on the 6th of October, and it is a discussion about a research paper that will be out by then that Strathclyde University students completed in cooperation with In Control Scotland around legal address. So about why people's experiences of self-directed support haven't worked well, where there hasn't been any legal precedent that's been set in relation to that. So it's a really interesting piece of research that we're going to launch in that week of the 6th of October, and launching on the 4th of October, I think is the plan now, isn't it? And we'll have a discussion about it with some of the research students who carried it out on the 6th of October as our next monthly webinar Wednesday. Okay, thank you to everyone who came. Bye.
We'll see you then. Thanks, everyone.
Thank you. Bye.